Hey guys, it's Mike and Marshall again with PhysioU, and we're going to talk about interventions for hip adductor strains. So our last mentoring minute, we talked about screening and risk factors, how to identify adductor strains, and today we're going to talk about more interventions. We'll start with more lower level on the table, progressing to standing dynamic stuff. When it comes time for interventions and treatment, early on, we may need to work on just gentle contractions of the adductor, PIR, so post-isometric relaxation. So gentle contractions, trying to just decrease some of the muscle guarding. So again, take them to a pain-free range. What I'm going to do, Mike, is gently bring your heel towards the other leg. Very gentle contraction. So breathe in and let it go. Take up a little bit of slack. This time when you breathe in, so inhale, gently pull. Isometric, gentle, and relax. Okay. Again, the idea is not to take them into pain, not to take them to a big stretch. Just try and get the muscle to turn off. As we progress through rehab, we want to start with isometrics. So we can put this ball between his knees. Okay? And have him gently squeeze isometrically against that ball. Hold that for 5 seconds. And then relax. Olmec did a great study looking at passive therapies versus active therapies for chronic adductor strain. So these people that had adductor strains greater than 40 weeks. And half the group did passive therapy, so stretching, massage, ultrasound, laser. And the other half did active strengthening, active therapy, so they did adductor strengthening, abductor strengthening, trunk control strengthening, and balance strength. And what they looked at after 8 weeks, 79% of the active group went back to sports versus only 19% of the passive group. The progression from at your knees would be with the legs straight, so hips extended, and then squeezing the ball at the ankles. Again, squeeze, 5-second hold, isometric contraction. So once you move from the table, we move more to dynamic stuff and lunges, multi-directional lunges. So go ahead and step forward and cross over. If you're looking at the clock, it's like an 11 o'clock lunge, and then do a 12 o'clock lunge. Good. A 1 o'clock lunge. Good. Always keeping your feet face forward. A 3 o'clock lunge. Right. Nice. Let's go to a 6 o'clock lunge. Right. Good. So weight on your front leg and bend down, drop this knee down. Good. And then now cross over to like a 7 o'clock lunge. Perfect. Good. And then another great exercise that there's a couple articles out is called the Copenhagen adductor exercise, where the patient is in a side plank. Right? And another player or therapist at this point stabilize one hand at the ankle, the other one at the medial side of the knee. I'm going to hold his leg up. He's going to lift his hips off the table, making a straight line as high as he can, higher, higher, higher. And then lift the other leg up, slowly down. And then hips slowly down. Okay. Again, hips all the way up, make a nice straight line. Okay. And then leg up, leg down, and the other leg down. At home, the patient can then do it with a chair. We'll stick a chair there. Again, ankles stabilized. Here, good. He's going to lift his hips up, high as he can go. Right, we want this to make as much of a straight line as possible. Lift the other leg up, other leg down, and then down. If that's too hard, we can always move the chair closer. He can bend his knee, and then his knee can be on there. Same thing, you can lift up, lift the other leg, down, and then down. And again, the goal is to keep the trunk as straight as we can, and then make a nice level playing field. Hope you guys enjoyed today's mentoring minute on interventions for adductor strains. We'll see you guys next time. Take care.